How does nonverbal communication impact lymphoma patient care? Imagine sitting in a room feeling overwhelmed and unsure about your treatment. Sometimes, what your healthcare provider doesn't say with words can be just as important as what they do say. Nonverbal communication includes facial expressions, gestures, eye contact, posture, and tone of voice. These cues help build trust and understanding, especially for patients living with serious conditions like non-Hodgkin lymphoma. Patients often pick up on nonverbal signals more than spoken words, especially when emotions run high. If a doctor maintains contact and offers a warm smile, it can make a patient feel cared for and understood. Conversely, crossed arms or avoiding eye contact might make someone feel dismissed or anxious. When verbal and nonverbal messages don't match, patients tend to trust the nonverbal cues more, which influences how they interpret their care and the information they receive. In the context of lymphoma care, nonverbal communication plays a vital role in reducing anxiety. For example, a healthcare provider who leans forward slightly and nods while listening shows engagement and empathy. This can help patients feel more comfortable sharing their fears or questions. When patients feel heard and supported through these subtle cues, they are more likely to feel satisfied with their care and less anxious about their diagnosis or treatment. Nonverbal signals also influence how well patients stick to their treatment plans. If a doctor appears supportive and attentive through their body language, patients may feel more motivated to follow medical advice. For someone with non-Hodgkin lymphoma, adhering to treatment schedules and medications is crucial for managing the disease effectively. When healthcare providers use positive nonverbal cues, it fosters a sense of partnership and trust, encouraging patients to stay committed to their care. Although the impact of nonverbal communication on health outcomes is complex, it contributes to creating a supportive environment. A caring, empathetic approach can improve the overall quality of care and strengthen the relationship between patients and their healthcare team. This is especially important for those living with lymphoma, who often face long-term treatment and emotional challenges. Practically, healthcare providers can use simple strategies to improve communication. Sitting down and leaning slightly forward shows interest. Smiling and maintaining gentle contact convey warmth and understanding. Using open body language, like uncrossed arms and relaxed posture, invites patients to speak freely about their feelings. Avoiding negative cues such as checking the clock or fidgeting signals disinterest and can make patients feel more comfortable and valued. In caregiving and support roles, understanding nonverbal cues helps caregivers respond more effectively to the emotional needs of patients. Recognizing signs of distress or fatigue through body language allows caregivers to offer comfort or adjust their approach. For patients living with lymphoma, feeling emotionally supported can make a significant difference in their overall well-being. Ultimately, integrating positive nonverbal communication into patient care fosters a more compassionate environment. It helps patients feel respected, understood, and supported throughout their journey with lymphoma. Always remember, combining these cues with clear verbal communication and medical guidance from healthcare professionals is key. For personalized advice and treatment options, it's essential to consult qualified healthcare providers who can tailor care to individual needs.